why it gets worse, menopause, and what we can do about it. Okay, so I'm Dr. Manon Fielding. I'm a holistic chiropractic physician for 30 years. I recently changed my audience, I guess you would say, to working more with women in menopause and beyond, an anti-aging program. And the program is called Holistic Strategies for Eternal Youth, Menopause and Beyond. And it works on the physical, the emotional, and the spiritual, meaning connecting the energy. And when we work on those levels, we have a more complete healing. The reason why that's important is because, and we're going to talk about that in relation to pain, if you have a lot of pain or you have all kinds of health conditions, they often are the result of internalized emotions. That happens a lot with trauma. It happens a lot with stress and feeling overwhelmed. And I'll go into that a little bit more in detail as we go on here. But if we connect on all those levels and remove those blockages and work on the physical aspect of pain, it won't come back. It will completely resolve it. So when I was going through menopause, I had very severe migraines to the point where I ended up hospitalized a few times. They had to give me shots to really deal with the acute problem, and it was very severe with the nausea and vomiting, and it really interrupted my ability to function in my life. I also had really severe pain in my leg, in my right leg, because I'd had an accident there and had injuries that developed were arthritis. And after I had a car accident, I was hit as a pedestrian by an SUV, and the pain that I had in that leg that I broke and the feet, my doctor actually, one of the foot doctors said that I might not be able to walk normally and I was going to have severe pain for the rest of my life. You can imagine, I'm a chiropractor and I have to stand all day. I was like, this is not going to work for me. So this is when I started really learning about menopause and pain and really learning how to work with it and what kind of practitioners and what kind of things I can do on my own. And I'm happy to say that today I have almost no pain, and I'm almost 70 and I feel great and I have great energy. So when we hit menopause, obviously there's a change in hormones. Of course, everybody I think very few practitioners really understand it on a holistic basis. And what the whole medical profession does is just throw hormones at it and then say, you should be all better now. I'm done. I've done my job. I gave you a prescription, and that's pretty much it with all kinds of pain, with any kind of issues like gastrointestinal issues also increase at menopause. All of the organs and joints respond to the change in estrogen. However, there are quite a few other things that we can do besides that, and also understanding that any kind of pain is a warning sign that something is wrong. And one of the things that I did learn in chiropractic school, if you were running out of gas and you're driving, gas light on, if you turn off that light and it doesn't say it anymore, you don't have the warning sign, but it's really not going to help you very much because you're still going to run out of gas. So that's really the same thing as pain. If you think about it, the body is giving you a warning. Any kind of symptom is giving you a warning. Pain is one type of symptom. Gastrointestinal, like GERD and indigestion, is a warning sign. And if you only put a medication in to close out that symptom, you're really not getting to the crux of the problem, and you're going to often get another problem. And that other problem, they're going to give you another medication for that one, and then you're going to end up, I can't tell you, like some of my older patients, how many medications they're on. They bring in their list, and oh my God, there's not a whole lot you can do once you're on those many medications. So let's talk about what we can do to not get to that point. When you're in menopause, you have a chance to make a change and make a transformation. And that's what the program that I do is all about, that Holistic Strategies course and coaching program. So I'm going to give you a little bit of that today. And I hope that you will join me for the whole course, and I'll explain that a little more at the end. Why do we have this happen during menopause? I said you have the estrogen levels, that's one thing. The other thing is stress. So if you've been under stress for various reasons, you have physical stress, you're in pain, that's a stressor. We also, during menopause, often have relationship issues. Things are changing in the home, and we don't get along with everyone as well because everybody's kind of making this shift. You might be at work, you might have work stress. You might have, I've seen a lot of women talking about having a lack of confidence in their lives. And is a stressor because you have still all the world is going on and you have less confidence and you're not being able to deal with it as well. And it starts to feel like a heaviness. A lot of women have anxiety and start developing depression. And I've seen a lot of isolation where you're not really going out and doing as much and you're not as outgoing as you may have been in the past. The other thing that can happen is sleep disturbances. And this can happen from the change in estrogen, but it's also related to changes in cortisol. And that's one of the signs of having altered cortisol levels. It could have like just a generally too high level of cortisol, or it may be that it's fluctuating and higher at night when it's not supposed to be at night. Then it will interrupt your sleep and make it difficult to have a good sleep pattern. And we really need to sleep like 7 to 9 hours a night. And if we're not getting that sleep, that can actually increase our pain levels. It can be a good thing because it is anti-inflammatory. But when it's chronic, it seems to increase our experience of pain because of its interaction in our brain with neurotransmitters that deal with pain. So I'm just telling you, when you have that fight or flight response, you are going to have an increased perception of that pain. So that's one of those things. Now, how do we learn to control some of these factors? And there are many things we can do in terms of food and nutrients. So that's one aspect. There's different types of relaxation techniques. I'm going to go into a little bit of that. I did mention in terms of sleep, the more and better quality of sleep that you have, the less pain that you will have. And then exercise. Exercise is a biggie. And I think a lot of people think that they can just eat. They might try to eat well and take nutrition, and then they skip the exercise part. You can't skip the exercise part. The exercise, even if you just do 20 minutes, so I would like to get it up to 40, but 20 minutes of moderate exercise, not vigorous. And that's another, I won't go into the vigorous exercise because that does extend life. But in terms of pain management and stress, even 20 minutes is going to be beneficial. So 20 minutes of walking, Tai Chi, yoga, stretching, stretch routine. And I have a copy on my YouTube site. If you look up Holistic Strategies for Eternal Youth on YouTube, I have a complete stretch routine from head to toe, and it is both relaxing and energizing at the same time. And then I have a complete 20-minute exercise routine that's from head to toe, also using your whole body, and it doesn't require any equipment and it's easy. So those are things that you can do if you can't get outside. The humidity just like overwhelming. This time of year, maybe not so bad. But the other thing I do that personally when I can't get outside is I do YouTube videos, and there are some really good ones. And I'll recommend to you The Body Project is one that's a low impact. So you want to avoid doing heavy exercise if you have any joint problems and any arthritis. You don't want to be jumping too much or running too much. I mean, running has its benefits. I'm not saying don't run, but it does increase our stress on our joints. So those are some things like physically that you can do. So that's exercise. there are also things that can naturally increase estrogen. So I did want to go into that for a second too, is that for those of you who don't want to be on estrogen that is given by your doctor, exercise actually increases your natural estrogen that your body will start to make it on its own. So that's one thing. And when you get the adequate sleep, it does. Then there are some things called phytoestrogens. You might have heard that soy products, flax seeds, beans, legumes, and whole grains all help to increase your own natural estrogen and work on your estrogen receptors so that your body thinks it has more estrogen. And I personally never did take estrogen. I thought about it, and my doctor was trying to get me to do that. But using these natural methods, I found ways to not have to take it, and my bone density is great. And I'm also going to talk to you a little bit about breast cancer, that there are things you can do to prevent that don't require you having to take estrogen. So those are plant foods that are helpful. I also recommend a wide range of colorful vegetables. So you really should be eating 3 to 5 vegetables a day. And I love for you to choose some leafy greens because that has a lot of calcium and that will help you with your bones, believe it or not. And have a wide variety of colors. So you get yellow vegetables, orange, purple. The more different colors that you incorporate over a week, those phytonutrients help with estrogen. They just help, and they have antioxidants that are going to protect against breast cancer and all kinds of cancers. I can't even stress enough to you how important they are. And I do have a video also about organic vegetables, and I do want to just mention that real quickly because there are some things that are used in the soil to grow fruits and vegetables, the non-organic, that actually interfere with your estrogen, and they can be very harmful, and they interfere with your thyroid as well. And so the more organic you eat, the less chance you have of interfering with your hormone system because of those chemicals. Okay, those chemicals, they have even found their way into tampons and diapers. I realized when I was researching this how extensive it is, and that's worldwide, unless it's been banned in your country, which I think England definitely ahead of the US in that regard. Okay, so those are the vegetables. We talked about exercise, maintaining a healthy weight. That helps with your estrogen as well. And that's a whole other topic, but I'll just say briefly, if you have problems with weight, you want to eat more protein, and you should be eating protein at every meal. So it's not okay to eat cereal for dinner or popcorn for dinner or breakfast. You need to incorporate, if you eat an egg with it, that's good. And especially if the cereal is whole grain, because the whole grains is going to help you reduce that as well. And I do have a whole section of our course involved with diet, but eating enough protein at every meal. Think about having 100 grams a day split up throughout your day, and think about that. For one, eating more protein and fat helps to change your brain's response and feeling full. So you're going to want to eat less. And part of that is how it affects your hormone system. And you will lose weight. I don't care how much fat you eat. When you're trying to lose weight, there's really no limit to what we recommend, because we know that if you eat the protein and fat, you're going to lose weight, and just choosing the healthy vegetables and fruits, if you just ate that, you would be much healthier, you would lose the weight, you'd have a lot less pain. So I'm not advocating to eat like big steaks at every meal, that's not what I'm saying, but eating enough protein and fat. So good fats, unlimited with olive oil. Canola oil is good too. That's a monounsaturated fat. limit, you can eat saturated fat, but don't make that the majority of it. Flaxseed oil is a really good one. And of course, omega-3 fatty acids. So any kind of fatty fish. And I had a professor who had very severe rheumatoid arthritis and a lot of pain before he became a chiropractor. And he studied nutrition and exercise and studied all of these basic lifestyle things that we kind of take for granted. And he went back in improving his sleep, staying outside a little bit every day, and he changed his whole diet and got rid of three most offensive foods in terms of pain are sugar, dairy, and wheat. Wheat is another big one. And people who have sinus pain and sinus problems all through the year, often one of those is going to be the offender. Then you have corn is another one. But I'm not going to go into a lot of detail of that. But if you're eating a lot of those products and you're having a lot of pain, try eliminating that for 30 days and see how much better you feel. All right, so that, and then stress management is another way to reduce pain. I know probably a lot of you know that meditation is good, but maybe you don't know how to meditate, or, I hear a lot of people say, but I can't quiet down my mind long enough to meditate. Well, that's the whole point. That's what meditation is for. And you don't have to sit there for 30 minutes and meditate. You can do 5 minutes and start with very simple, just slow breathing. Just breathing and focusing on your breath. If that's all you do, you're still helping calm down that stress response. You're staying present in the moment, which reduces the feeling of stress and keeps you present in that moment, and you reduce your anxiety level. There's a breathing technique called the 4-7-8 breath. And if anyone's interested, I can send you a sheet on that. You just take a deep breath from your belly, breathe all the way up for your chest, and just don't raise your shoulders like that. Hold it for a count of 7, and then breathe out for a count of 8. And focus on that, the counting and the breath. 4, hold 7, breathe out 8. That technique has been taught in the military to a lot of men and women who had severe PTSD. And when they started practicing that on a regular basis, they started having a lot less pain and emotional pain. I mean, emotional pain often leads to physical pain. So that slowing down our breath and doing that on a regular basis is another thing that we can do to relieve chronic pain. And you probably notice when you're in a lot of pain that you're breathing very shallowly, and that just actually, it's kind of a response that we have. That's part of that when we have high cortisol and we have a stress reaction, but it's contradictory to actually fixing the problem. So those are all important things that you can do. So the last one that you can do yourself is avoiding excess alcohol and caffeine. Doesn't mean you can't have a drink or can't have, in fact, having a glass of wine every day is very anti-aging because of the resveratrol in the wine, and having a drink is good, but you don't want to have, women can't process alcohol as well as men. And if you're drinking more than 1 or 2 in a day, that's definitely going to contribute to your pain perception and your pain. And excessive caffeine. Another one is the omega-3 fatty acids. So omega-3 fatty acids are very pain reducing and help a lot with inflammation. I recommend, this is something that you should be doing every single day, taking some form, either in food, it can be in food, or a supplement. And probably around 1,000 to 2,000 milligrams, I think it's in milligrams, a day will depending on your level of inflammation and your level of pain is what you need. And usually if you do it for a period of time, you'll be able to, kind of reduce it after a while. The other one that has a lot of omega-3s is walnuts. I forgot about that. Walnuts is really good in terms of helping with that hormonal balance and helping to reduce pain. And a very important one is vitamin D. A lot of women, a lot of doctors really don't understand the value of vitamin D. Vitamin D now, with longevity specialists, they often look at your vitamin D levels as the number one important factor in terms of your overall well-being, which is kind of amazing, really. I mean, we grew up knowing that you're supposed to go out and get some sunshine to get vitamin D, but only in the last 5 years or so have they really recognized how important it is for our health. So when I started taking increased vitamin D, my own estrogen levels were much higher and were much better, and my pain level went down, and I started feeling better in general. And so I recommend all women taking at least 5,000 IU, and you might need more, but that at least we know that that's a safe amount. In fact, up to 10,000 is considered safe for everyone. And in the winter when you're not going outside as much, or you don't go outside, and plus as we get older, we don't process vitamin D as well anyway. So the vitamin D, now they found that it protects against 83% of breast cancer. Okay, 83%. So I think every gynecologist, every doctor should be talking about that. Okay, you're asking about K2. So there's a little bit of controversy about K2 because K2 is in a lot of things that I'm recommending you eat, and we do store it, whereas vitamin D does not get stored. It's one of the fat-soluble vitamins that we actually need on a daily basis to take. I don't think it will hurt you to take with the K2, but the research is not as definitive on whether you have to take it with K2. If you do, that's fine. I was taking it with K2 for a long time, and now I'm not, because a lot of the people that I follow in terms of the longevity science are, say it's controversial and it's more expensive. So maybe try to get it from your diet. I'm trying to remember. So green vegetables, like I was talking about, the leafy greens have K's in them. I know we don't eat a lot of liver, but liver is one of them. Eggs, I eat eggs a lot. Eggs has K in it. So if you're eating some of the foods that have K in it, don't worry so much about that. And if you're taking the omega-3 fatty acids, that helps to keep your arteries clean also. So you're not going to have as much need, because that's what the K is for, to help prevent atherosclerosis. All right, that was a good question though. Okay, herbal supplements. So herbal and nutritional supplements to help with the estrogen levels and pain. So one of the ones I wanted to talk to you about today is the turmeric. Okay, turmeric, I take this one, and it's not the only one, I'm just giving you an example, but turmeric with ginger, BioPerine, and boswellia. The reason I like it with the boswellia is that boswellia helps a lot with pain and the perception of pain, whereas the turmeric is more anti-inflammatory. So both of them work really synergistically together, and that's why I like this formula. It's organic, and it's Dr. Olivia's. I get it on Amazon, and I don't get any, kickbacks from them recommending this, although I recommend it all the time. But I think, if you're having like the kind of pain, arthritis type pain in your joints, then I highly recommend this along with the omega-3 fatty acids. All right, what else? In terms of estrogen, there are some really good products that are only available through health professionals, and one of them is called protomorphogens. And a protomorphogen is a nutritional component that is a prototype of a healthy cell from specific organs. All right. So the one that I recommend to my patients that are going through menopause to help them with estrogen production and hormonal balance is called Simplex F. And Simplex F has the protomorphogens for ovary, thyroid, pituitary, and adrenal, because those are the 4 major hormonal organs. And when they are able to better be healthy on their own and communicate with each other better, we are able to produce enough estrogen to avoid a lot of the negative effects of the changes in estrogen. The adrenal glands are supposed to kind of take over from the ovaries. When the ovaries start going down, the adrenals can start producing more of these hormones. And I don't think most people really recognize that, and certainly most doctors don't understand that, but our body is a pharmacy. We can produce almost, I want to say almost, we can produce anything that we need to live healthily. I don't think we know how to do that all completely yet, but these are certain things that the ones that I've been going over today are ways that we can stimulate our body to create that health and create that balance that we're looking for, and not only reduce pain, but help with our energy, our weight management, our gastrointestinal system, and all of that. It's just so much benefit that we can do on our own. I didn't even realize I started studying Joe Dispenza, who does a lot of meditation teaching, and he talks about how they've actually measured that people produce their own opiates, and that's very pain reducing, that through meditation and getting into certain wavelength and wave states in meditation, that you can produce your own pain reducers, including opiates. So that's actually pretty exciting and pretty amazing, and that's very new research that is being explored now in all these various ways. All right, or other herbal supplements that you might explore also if you really are very deficient and you want to do natural things is black cohosh, red clover, and dong quai. Really, all 3 of those help to reduce a lot of symptoms of menopause if you don't have access to some of the ones that I mentioned, the protomorphogens, because like I said, most of them are available through health professionals, and they can really benefit. And start out, with herbs, you have to not take too much at one time. Like start with a little bit, see how you feel, and increase it if necessary, rather than starting with a really high dose. I have patients who, for pain, they want to take ibuprofen. They start taking 4 or 3 times a day. You're really going to destroy your liver and your kidneys if you overdo that. And I'm not against taking a pain reliever as you need, but we don't want to live on that. And herbs are also can be very powerful, and we need to just be judicious. And if you're working with a professional, that's great. If you're not, like I said, just a little bit at a time is good. All right, let's see. So I talked a little bit about cortisol. Oh, I want to talk about professionals also. So what kind of person would you go to if you're having a lot of physical pain and you need actually some hands-on care? So I've been working as a chiropractor. I do that a couple of days a week now, and then the rest of what I do is the virtual work with menopausal women, anti-aging. And I wanted to suggest, if you're having joint pain and you need to go to a chiropractor, go to someone who does a very low force technique, a gentle kind of chiropractic, not just like really hard cracking, twisting. That's what I hear a lot of people complain. Oh, I'm afraid to go to a chiropractor because they're going to twist my neck, or I've heard they hurt me one time. Well, the reason you got hurt is because they were probably too forceful. Don't need a lot of force to correct an imbalance in the spine. And with this instrument, which is, it's very gentle, I can work on every joint of the body. I have a lot of patients with wrist and hand problems, knee problems, hip problems, neck problems, and this instrument can move the bone in any direction that it needs to go. And that's what they're trained to know how to use that. And I would suggest also that you go to the activator.com website. Thank you, Rhonda, that I'm glad you love chiropractic. Chiropractic is really the most amazing health profession, and I really feel great being part of that because it's completely holistic and natural. And what it does is actually, the philosophy of chiropractic is from above down, inside out, healing the body from the inside. So you know that the hormonal system is a main control system of the body, but what controls the hormones? Actually, the nervous system controls the hormones. The nervous system is your brain communicating to your spinal cord and out to every organ, internal organ and external part of your body. And so if you have something out of balance, even in a joint, so let's say, I don't know. Okay, when I was hit by that car, I fell, broke my leg. I landed also on my wrist, and I had a lot of wrist problems. So I was able to do myself with the instrument, just correct it. So carpal tunnel and things like that. So if you need any help finding a good chiropractor, let me know. All right. So the chiropractic, I also really strongly believe in acupuncture, massage. All of these body techniques are amazing for dealing with chronic pain, and you might need all three, or you might just need one. They have different ways of working, and they have different. Like, I went to an acupuncturist for some gastrointestinal issues, and I feel like that really helped me a lot with that. And they gave me some Chinese herbs, which that's not something that I know a lot about. So there are different practitioners, and I strongly recommend, because when you go to a holistic practitioner, they're looking at you as a whole, not just someone who has a hormone imbalance or someone who has a GI imbalance. In fact, I've been to so many gastroenterologists, and I'll tell you the truth, they did not help me at all. So those are all, things that I really recommend for chronic pain. And we talked about, things that you can do yourself, nutrition and other lifestyle changes. And we talked about different type of practitioners. And if anyone is interested in working within my program, the Mind, Body, Spirit, and completely transforming, so it's not just the physical, like I said, we're working on the physical, spiritual, and emotional transformation. We work on relationships. We work on prosperity, because that's a big issue for a lot of women that, fear if you're not in a relationship or a marriage and you don't have a lot of money saved up. It's a little scary as we get older. Are we going to be able to live a nice lifestyle if we don't have the prosperity to do that? So this program is all inclusive of those kinds of things that women our age are concerned about. and it leads you through step by step, like peeling layers of an onion. We all have different things that are important to us and different things that we want to change about our life. And so the program is minimally 12 weeks, so you can do it in 12 weeks, but it goes on for a full year. You have access to the program for the full year. If you're interested in that, you can find it on askmeanythingaging.com. And I will post a link if you want to do a consult with me and just talk about it, and we can see if it's something that might benefit you. All right, any other questions? Oh, how do I feel about inversion tables? Oh, I like inversion tables. I think they can be very helpful, and I think they do, I guess one of the biggest things that I see is damage from sitting too much. That's the new, instead of just the construction workers or the people who are moving furniture, people sit a lot, and it compresses your spine, and they have more back problems and neck problems and wrist problems than anyone else. So the inversion tables are great because they help deep compress that, open up the nerves. And some of them, you could even do some core exercise on there. I found I got dizzy when I tried to do that on an inversion table. But yeah, Rhonda, I do totally think that's a great idea, the inversion table. And laughter is probably a very important one. So I'm going to just stick that in there at the end, that you can't laugh too much, and that increases those little happy hormones in our brain and in the rest of our body. All right, so you guys have a wonderful day, and namaste. Look forward to talking to you again. Bye-bye.